Hello and a warm welcome to The Crowd Live, where ideas meet opportunity. I'm Ross Westgate here in London with a special edition of the show, one that's celebrating female entrepreneurs with great ideas. Last year, over 880 businesses a day were launched in the US by women. Today, there are over 11.5 million female-owned companies right across America, generating more than $1.7 trillion in annual revenue. But despite those impressive numbers, TechCrunch says that US female startups raised just 2.2% of venture capital investment in 2018. We're about to change all of that. On today's show, we have 8 women who think they have the next big idea and are ready to test them with The Crowd. But before we begin, what is The Crowd? The Crowd is a platform literally open to anyone with 2 big advantages. For entrepreneurs, it doesn't matter who you know or where you come from. The only thing investors care about is the quality of your idea and your ability to execute it. For investors, it dramatically cuts the time needed to find the best new business ideas from anywhere in the world. Saving time is saving money. And who knows, the next big idea could be just a swipe away. But to stand out from the crowd, our entrepreneurs have to face our own crack team of interrogators, our impressive lineup of experts who, along with you, the viewer, will assess today's business ideas. Joining us in London is Prue Freeman. She's co-founder of the Australian restaurant group Daisy Green. Launched in 2012 as a street food vendor, today the company has 10 cafes right across central London. Prue, it's great to have you on the show. You've raised $3 million in venture capital since about 2015, but from your experience, what are you looking for today from our hopeful entrepreneurs?
Thanks, Ross. It's amazing to be here and to have eight women. I think being a woman coming out of finance and into my own business and having been through a couple of crowdfunding experiences, I think just looking for women who've got that go-getting approach, that kind of fearless approach to being an entrepreneur, having an idea that maybe will change along the way, but having that determination that they will make it work. And so I think it's amazing to have, an all-women set of investments today.
It's going to be fantastic, and I think we've got some pretty fearless entrepreneurs, so I don't think you'll be disappointed by that. Prue's not the only expert we have. Also joining us in San Francisco is Jenny Johnson, President and CEO of Franklin Templeton, which has assets under management over $700 billion. Jenny oversees the majority of investment management and support services, including the company's high net worth business. In Chicago, we're joined by the president of Nuveen Advisory Services, Margot Cook. Margot is responsible for leading the global distribution, product marketing and solutions organizations at Nuveen, a nearly $1 trillion asset manager overseeing client assets in more than 30 countries. And finally, but by no means least from New York, we're joined by Suni Harford. Suni is head of investments at UBS Asset Management and chairman of the UBS O'Connor Hedge Fund. She's considered one of the most powerful women in finance, overseeing $831 billion in assets. Jenny, Margot, Suni, thank you so much for joining us on The Crowd. If I could ask you as well, Suni, what is it you want to hear today?
I just love the whole idea that we're working with female entrepreneurs. I'd love to hear something unique and something that these entrepreneurs are passionate about. That's what it's all about, and it's what it takes to really succeed as an entrepreneur, I think.
Jenny, what's going to have to stand out for you?
Well, I think, as Suni said, I think passion is so important to be, being an entrepreneur is really tough, and there's going to be a lot of the barriers along the way. And so if you're not passionate and completely believe in your idea, you're not going to be successful. So I think looking for passion and then looking for something unique, something that somebody else hasn't already done.
Margot, what would you add to that?
Well, all great points, but I'd say, what problem are we trying to solve for? And then how does that problem get protected? So how is it different? And then how do we protect the IP around the solution?
Well, it's great to have you all here. The crowd control experts are ready. But even if our entrepreneurs pass their test, there's still one last group they have to convince. And that's you, because yes, you're part of the crowd. And we want to know what you think. So make a noise, type in your questions. Let us know, what would it take for you to swipe right? So that's it. Now it's time to find out who can stand out in the crowd. Our first pitch is from Lauren Choi, CEO and founder of The New Norm. Lauren's aim is to transform recyclables into athletic wear.
Hi, my name is Lauren Chat, and I'm the CEO and founder of The New Norm. We are turning plastic water bottles into fabric. What sparked this idea was an article I read this past August, which talked about how China is no longer accepting a lot of our recyclables, and cities are struggling with this because they have to end up throwing their recyclables away into landfills. We wanted to do something about this, so we are currently a team of 24 undergraduate students at the Johns Hopkins University trying to make this vision a reality.
To do this, we are making our own machine. It consists of a square metal hopper that funnels the plastic pellets down a steel tube lined with 4 band heaters and a nozzle at the end.
We believe that if we continue at this pace, we will have fabric by the end of the spring semester.
Our goal is to have clothing by the end of the summer. We want to begin the production process by creating our own line of clothing and working with domestic manufacturers to create our own sample designs.
We recognize that if we want to make an impact, this has to be done on a large scale. We are currently looking for mentors and partners, people with experience in the fashion and textile industry that can help us achieve our vision.
And joining us now is Lauren, all the way over in Baltimore. Hi, Lauren. Good to see you. Thanks for joining us on The Crowd.
Yeah, of course.
Look, it's a great idea. Love where you're coming from. Just explain to me, there's 24 of you, all from Johns Hopkins University. How have you shared the business out amongst you?
Oh, wow. I mean, we started back in October 2018, and all of these people joined out of interest. I sent out an email, and each individual person reached out because they thought this was a project where they could finally apply the things they were learning in class to the real world, to a project that addresses things that will affect us in the future. And so, I mean, really right now we're in the prototyping stage, and it's all about just working through each obstacle. We have 3 teams. We have 2 technical teams, one testing the materials, one building the actual machine, and then we have a public policy team that's, really researching how this project can work with the city of Baltimore. And so, yeah, I mean, we're really in that work stage right now.
So you're looking for mentors, and particularly those in fashion and textiles. Pri, what question do you have?
I think it's an amazing sort of social project, but I think from where you stand as well, turning it into a business that can become a global business, is how do you think that you can make textiles that can compete on a global scale? So obviously you're probably competing with the Far East in terms of people selling the materials, but do you think you can get it eventually to economies of scale where actually you're producing something at a price which can work as well?
Yeah. So this is a thing I've thought a lot about, and that is, this is a technology that exists. So people are already doing this, and a lot of times it does occur in Southeast Asia. And then I noticed American companies were then going to these textile manufacturers in those other countries to get their resources. And I think our generation has become very accustomed to ordering something and then watching the shipping, tracking, fly from China to this country, to that country, and then finally it arrives at our home. And that's kind of the issue I had with all of that, is why can't we bring the textile industry back to the United States? And I think since the technology exists, I do believe, since the U.S. is facing this recycling challenge and these issues right now, since China is no longer accepting a lot of our recyclables, cities want companies to take their recyclables away from them. So they are selling it off tons and tons for almost free. And so that really limits that cost. And then it's really about just creating an efficient machine, which is what we are trying to do right now. So yeah, I do think eventually we can compete. Yes.
Fantastic.
Yeah.
I guess too, the other big thing is the world has a big social conscience at the moment, and I think probably for you, using influencers to get that message out there and to encourage people to support your business, is that something that you're working on, an influencer strategy at the moment of how you get this business out there?
Yeah, I mean, definitely. I think people, don't realize how much the fashion industry pollutes the world. It is the second dirtiest industry after, you could say, oil and gas. And so, I mean, we're doing that through social media. We're doing that through our school, and just spreading the word that way. But yeah, I think people should be aware of what they are purchasing. And that is something we would like to continue more and more as we grow as a business, because I think a lot of the time we as customers and we as buyers have kind of lost that personal connection with what we are buying at a store. And we would like to bring some of that back. Jenny, what do you want to know?
So I'm just curious, how is the texture on the material? I'm sitting here thinking, all right, I think it's a great idea. I would love to have the plastic work, but people are going to want to make sure, one, that the material looks good, and two, that it feels good on them. So how do you deal with that?
So most people don't know, but polyester is the same molecular structure as plastic, PET. It is the same thing. And so it's very easy to create a filament and then just weave it into your classic polyester. And there are machines out there, industry size level machines that do this already. It's just not considered cheap enough. It is still cheaper to make brand new materials from chemicals to create polyester. And I think we can kind of bridge that gap.
So you think you could bring down the cost to what it would cost to just generate or to create polyester today?
That is the goal. Yeah. That is definitely what we are striving for.
And is there anything that you're doing that, to Margot's point earlier, that would be patentable so that it can't easily be replicated?
I think we would have to see down the line. I think it depends on how our prototype kind of grows alongside us, because we have our initial designs, and I think we want to improve the efficiency of it, improve, the nozzle, what type of thread does it produce, things like that. And I think we have had so many surprises already along the way, and I think it's just going to be a learning process for us. So I mean, we'll have to see.
Margot, Suni, questions for...
Lauren, I'd love to know if you've got, in terms of sourcing the plastic, is your prototype going to be something you can put next to all these recycling plants? How are you going to transport all of this plastic waste to your central place? Are you going to be in one place and things are going to come to you? Or are you going to be small enough that you can be local to all of the recycling plants around the country? How do you manage that? Because that seems to be a very large cost part of the discussion.
Right. So right now we are on a very small scale. And so we are really only planning on working with our campus and the surrounding area. And I think that's what our prototype could handle. I mean, if we do grow and if we get on a larger scale, yes, I would like this to be a way that cities address how they recycle. I mean, the U.S., compared to other countries, already has a great waste management system in place. I mean, we all have our blue bins and a truck comes once a week and collects it for us and we don't have to think about it again. But there are these sorting facilities already in place, and companies buy recyclables for various reasons. And I think, to set up a place in a city where you use the local resources and directly manufacture them into a filament and then weave them into fabric, knit them into fabric. I think that should all happen in a very local ecosystem. I think that should be a cycle that becomes
I think you might want to think about creating something that you could sell to the different cities, right? And they could have it on site as part of their thing. It could be a revenue stream to them, and you guys are the inventors, if you will, of this prototype. Just a thought, because I think the rest of the world should want to have these, and I think most countries, cities, municipalities are going to need something like this in the near future.
Very quickly, Lauren, as well. I had a question from Chris as well, who's from the crowd, who wants to know, are there other people doing this? So what's your competition?
I think we have two forms of competition. One, yes, it's clearly a movement. Big companies have started producing, leggings out of recycled fishing nets and a shoe made out of recycled plastic. I mean, this is clearly something that people are testing out with the general market. They're trying to see, is this something that people want? And yes, it is. It is succeeding. Businesses that have been doing this are very excited. The one thing I do think that sets us apart is if we were to completely keep this process within the United States, I think that is what kind of I think that's what makes us special.
Okay.
Because yeah.
Look, Lauren, it's great to have you in the crowd. Thanks so much for joining us. We wish you all the very best, and we'll follow you with interest. Thanks so much. Lauren Cho is the founder of The New Norm. And just a reminder, The Crowd is an enabler, simply allows entrepreneurs to connect directly with potential investors. No endorsement of either any person or business that appears on The Crowd is implied by their participation on the show. Now, our next big idea comes from a Georgia Tech grad who comes from a family of entrepreneurs. And she's looking for investment in her company, which is trying to tackle the unmet needs in the feminine consumer market.
Hi, my name is Sarah Bush, and I'm CEO of TINA Healthcare. TINA stands for Tampon Insertion Aid, and it's a reusable tool that clips on to off-the-shelf tampons and makes them easier to insert. We found this problem by talking to over 1,000 women about their experiences with tampons. And this project started at Georgia Tech Biomedical Engineering School in a design class. And I've recently graduated and I'm taking it on full-time now. So we're in paid beta testing with different iterations of what an assistive tampon insertion tool could look like. And we're looking for investment and mentorship to bring us to market. And I think that our secret sauce is that for the first time ever, we are female product engineers and designers creating solutions that women want. So I'm very happy to be on The Crowd Live, and thank you to everyone who's watching this, and I'm excited to participate. Thanks again.
And Sarah joins us now live from LA. Sarah, good to see you. Thanks very much. It's quite special. You've got female product engineers and designers for a female product. You're looking for $150,000 for 10% of the business. What do you want to use the money for?
Yeah. That funding would get us through. So since we're a hardware startup, a big portion of what we need to be doing right now is designing and iterating, as well as really creating a patent thicket. So we're looking to lock down all of the embodiments of what this could be and kind of creating security there. And then on top of that, we're looking to get into our first round of injection molded prototypes, our units really, and launch that off with a Kickstarter campaign. So we want to do a social media matching to market up with that, and then also fulfilling on the back end with some really nice units.
Margot, what do you want to know?
So how have you established that, so what's the market for this, and how have you established that there is a, there's obviously a population of people that need this kind of a product. How have you gone about finding who those people are?
Definitely. So we started by talking to women with limited dexterity, and that's our most pertinent need, and that's women with spinal cord injuries, cerebral palsy, multiple sclerosis, arthritis. And we started there and started figuring out how do you insert a tampon with no dexterity? And as soon as we were kind of socializing that idea, we're getting inbound inquiries from people with pelvic pain, endometriosis, or women who are overweight and have problems with reaching. That can also be spinal curvatures. Beyond that, there's also an entire cohort of women every year who start their periods and could use an assistive tool to kind of, right now, the workaround is somebody shouting at you through the bathroom door, or maybe even somebody coming in. So we're really just looking at ways to kind of create a really user-friendly tool, starting with those people with the most extreme need, and then tweaking it and iterating so that it can just be added convenience for everyone. One thing I forgot to mention is that 1 out of 3 tampons gets inserted incorrectly, and that means that it's uncomfortable and you have to go in and readjust. So that's really what we're gunning for, and starting from the disability space.
Prue, do you?
Yes, and is it something that you foresee people using on an ongoing basis all the time, or is it more for those sort of special needs and when people are at the start of sort of their cycles? Yeah, I'm hoping that it can be kind of like a luxurious Cadillac kind of inserter. So, and I talk about this with my friends a lot. You wake up in the morning and you kind of don't want to be bothered. If something about that week could be more convenient and less frustrating, I think that's really where we're going for with the value added. So maybe just at home if you don't want to carry it, but any way that we can increase comfort during that time for women as engineers on our side, that's what we're going for. And what are you looking to, how much are you going to charge for it?
So it'll be a reusable device, and right now I'm trying to figure out if we're selling it independently. I want to sell for somewhere between $20 and $30, probably 25. But I would love to also be able to market with our own tampons, and perhaps we could tweak and iterate that so that the tampons could have a little bit less waste associated with them as well. So on that business model, it would factor in the cost of the tampons, but right now just selling independently, $25.
Sarah, it's been great to have you on the Crowd. Thank you so much for joining us. We wish you all the best, and I think it's a niche market, but clearly there's a lot of potential there. So thank you so much, Sarah Bush, co-founder and CEO at Tina Healthcare. Now, if you think you have a great business idea and you want to join the Crowd and even get in here on the Crowd Live, you first have to sign up to the app. Here's how. Right. We'll tell you a little bit. Here you go. We source all of our guests exclusively from the pool of the most followed entrepreneurs on the Crowd app. It's completely free to upload your 60-second pitch video on our website, thecrowd.net. For those of you looking to invest in some of the ideas you've seen tonight, or maybe you'd like to see what else is on offer, you can download the app. There you can watch all the pitch videos and swipe right if you see something you like. Finally, if you don't want to miss out on the next live show, or you want to watch an episode that's already aired, all you have to do is go to the upper right-hand corner of the homepage and simply click on the Crowd TV icon. So that's how you get involved. Please do. Our next entrepreneur is seeking $1 million investment in order to help grow her business, which specializes in the licensing of fine art.
I'm Kirsten Soderlund, co-founder of Arterial. We have an MVP, are revenue positive, and aim to disrupt the $9 billion market for licensed art products. Our mission is to ensure people who are passionate about art get access to art as affordable reproductions. Everyone deserves to live with a Picasso. Unfortunately, reproductions of the most coveted art is limited. Piracy and unauthorized use have led to a lack of trust from artists and museums. Arterial has assembled a brilliant team with over 100 years experience with museums, licensing, and technology. Our e-commerce platform and art registry securely captures permissions, transactions, and distributes payments. We reestablish trust by giving visibility and control back to content creators and sources. In exchange, we retain a percentage of the licensing and print transactions. Arterial is seeking $1 million to promote our mission, grow our revenues, and scale our art registry platform.
And joining us now is Kirsten Sonderland, CEO and founder of Arterial in Seattle. Kirsten, good to see you. Thanks very much indeed for joining us. We heard you're looking for $1 million for 25% of the business. That values your business at $4 million. Why do you think it's worth so much? I know you've got, 35,000 images already in your asset manager?
Yeah, so it's a combination of the fact that we already have existing revenues, probably besides the digital asset management system with, as you pointed out, the 35,000 images, we already have an art registry blockchain-enabled MVP that we are launching in April. And we believe this is extremely valuable and is ready to go. We also have, amazingly powerful in art market experience, connections, and relationships, as well as I say, the fact that we are working with the Seattle blockchain web developers. So you put that together, and we believe that our current valuation is $3 million.
Jenny, what is it you'd like to ask?
So admittedly, I don't know much about this space, but I guess what the question I have is if the concern is around trust in this and you are licensing so that it will be legitimate, isn't your price point still relevant as to what amount of fraud and reproductions are done, illegally or unlicensed? And how do you control that? Because I would think that would affect your pricing.
To be frank, I mean, our pricing really has very little to do with the trust back to the artist. What we're doing is that we have the art registry, which through the new blockchain secure technology gives transparency and security and ensures payments back to the artist, regardless of what the price is. Now, we can't control those who are not using our registry. And so as far as the piracy that's out there, we just hope that we're going to make a huge impact on how much is actually being used illegally compared to following our legal systems. Because I do believe that most people do want to compensate artists and do want to see that the museums and the creative holders, are compensated.
Suni?
Just curious how this works and how you're not in competition with the galleries and the museums that are sitting with this art. So if there's a Picasso out there and no one's got a copy of it, don't I just go online to the museum where it's hanging and can get a reproduction of it? Or what's your competition, I guess?
The good news is we have very little competition, but the answer is you can go online to some of the museums and find some of the works. In most cases, they've been printed, through traditional publishing mechanisms, offset printing. And so you might find, 10 images from the Metropolitan Museum of Art. You're not going to find the entire collection that our on-demand processing and system supports. So, most of the museums don't have the capacity or the resources to do what we're doing for them.
So you guys are on demand?
Yeah, we're totally on demand. If you don't,
I missed that. Okay.
Yeah. So we don't print a product until it's ordered.
Okay.
And so there's no inventory and no inventory risk for the museums.
And Kirsty, just so I understand, so we can all understand here. Is your competitors Getty or Corbis? Are you supplying direct to publishers or direct to consumer?
So no, we're not. It's interesting. I worked for Corbis prior to starting this company, but no, Getty Images and Corbis basically license images, and actually they have very little art, and they don't clear rights. So we actually are quite different from them, and there really is no one in our space that is actually doing the entire process of getting the image, clearing the rights, and then providing distribution. So, there's no competition there whatsoever. And as I say, the museums themselves and the galleries themselves don't have the resources to do it themselves. So that's why they look to us. And we've been doing this for the last 10 years in our prior company. And now with the art registry, we can do it even more robustly.
Okay, well, look, sounds fantastic. I'll come have a look later, see if I can find an image that I like. I'm sure I can if you've got 35,000 of them. Kirsten, really good to see you on The Crowd. Thanks very much indeed for joining us, and we wish you the best of luck. Kirsten Sondland joining us from Seattle and Arterial. Now, it's you, the crowd watching at home, who ultimately decide, of course, if an idea is a hit or not. So for those interacting via our website, please give this idea a thumbs up or a thumbs down, a swipe left, or even better, a swipe right. We want to know what you think. It's really important. Please do so. So the next entrepreneur also thinks she has $1 million idea. Claire Zhu is looking for seed money to bring her medical device to life.
Voyant is developing a smart toilet platform that fully automates point-of-care urine diagnostics. Our first solution improves the efficiency, accuracy, and patient experience of pregnancy and general urine analysis testing in emergency departments. Today, this and the manual testing process is a standard of care. Pregnancy testing can take 65 minutes as samples sit idle, leading to delays in patient care. It's also prone to user errors, and it's messy. Our add-on device to toilets performs urine testing in 5 minutes, from specimen collection to delivery of results to the EMR. Our test cartridges perform a full day of tests without staff intervention, reducing the cost per test by 50%. We've got a razor and razor blades business model with recurring revenue from test cartridges. We tested our MVP in a successful clinical trial with Northwestern University, and we're now raising a $1 million seed round to support product development for an emergency department clinical pilot. Through connected diagnostics, Voyant is improving frontline healthcare delivery and ultimately enabling the future of virtual health.
And Claire joins us now from Chicago. Claire, good to see you. Thanks for joining us on the Crowd Live. As you say, you're looking for 1 million seed at a 5 million pre-valuation, about 70% of the business. You've already conducted this clinical trial at Northwestern. So what's the next stage? Where exactly does where would this money go?
Yes, so our next step is to support product development for the next iteration of our product for our clinical trial in an emergency department setting so that we can demonstrate the operational efficiency and the patient experience benefits of our device. And so that $1 million will go to product development as well as the cost of doing a clinical trial.
Margot, how much does this idea interest you?
So I love this idea, and I'm not just saying that because I'm a fellow Chicagoan. It's a great way to really sort of unlock some of the issues and medical issues that are happening, particularly in communities where you can't get this testing, or you might not be able to seek out the right medical advice. So I think the idea is fantastic. I have to say I've heard of this idea though from other companies, and I'm just wondering what's different about what you're doing, and how do you keep off the competition?
Sure, that's a great question. So there are other startups working on smart toilet technologies. For us, the value here is that we are developing a platform that really is suited for practical clinical use. And what I mean by that is it's suited for use by multiple patients, different patients across a period of time. And so we have in our technology a mechanism for eliminating cross-contamination. A lot of the existing products are focused on home use, where you're focused on one individual, or research use where you're focused on one individual. And for us, we're able to test a volume of different patients and ensure that the results are accurate.
Great.
Suni, what do you think?
Well, it's kind of a gross question, but maybe a practical one. How do you clean it, right? You guys picking them up from all the doctors' offices and cleaning them in a special way? Or are you training doctors how to do this? Or it looks from the picture a little more complicated than the usual.
Yeah, so how it works is that once the patient is done urinating, it collects the urine, it runs the results, and then it sends the results to EMR. During that process, it also initiates a self-cleaning process, so it's able to sterilize the device and the collection mechanism and ensure that there's no cross-contamination result, and that's built into the device, and it leverages the water from the restroom.
Wow, well done.
Yeah, Claire, we've had a number of questions from the crowd. They want to know the size of the addressable market, but Jake in particular wants to know whether there's potentially crossover application to, say, police stations for drug testing.
Absolutely. So for common urine testing, which we consider pregnancy testing, general urine analysis, as well as drugs of abuse testing, that constitutes a $12.2 billion market. So it's quite a big market there. And certainly there are a lot of other use cases beyond clinical use. So drugs of abuse, obviously, in correctional settings would be one of them. Another use case would be remote diagnosis of infections in senior populations so that you can prevent hospitalizations and basically determine whether a patient has UTI before they even need to go in. So certainly there are a lot of applications beyond just that of the emergency department or clinical setting.
Claire, good to see you today. Thank you so much in joining us from Chicago. We love people from Chicago, as you know. Good to see you. We wish you all the best. Claire Zhu, CEO of Voyant Diagnostics. And don't forget, just a reminder as well, that the crowd is just an enabler. We simply allow entrepreneurs to connect directly with potential investors. No endorsement of either any person or business that appears on the crowd is implied by their participation on the show. Now, technology may be driving solutions, but our next entrepreneur believes that the success of a company is all down to its human capital. She wants to make executive coaching accessible to all.
Hi, I'm Tressa Escandanian-Yi, and I'm the CEO and founder of Leader EQ. Leader EQ is an on-demand executive coaching platform that is transforming the way business leaders and coaches connect. Our proprietary AI-powered matching platform disrupts old-school thinking with next-level compatibility, communication, and execution. We are looking for both partnerships with decision-makers that believe in the enhancement of human capital, as well as currently raising our seed round. Our platform is a dual marketplace whereby companies pay us an annual membership fee for unlimited hours of coaching, and we pay top-tier coaches their hourly rate. By doing so, we provide high-quality coaching with a guaranteed match to the right coaches for your needs. In essence, we're modernizing and democratizing the executive coaching space. Our algorithm, custom technology from calendaring, messaging, and note-taking makes Leader EQ the best platform on the market for executive coaching. Coming from the talent acquisition space and human capital space, we know how to provide white glove service with next level efficiency. We just recently launched about 4 weeks ago and are currently onboarding both clients and coaches all around the country.
And Chesa joins us now on the Crowd Live from San Francisco. Chesa, really good to see you. Thank you. You're looking for seed of around $3 million for 20% of the business, with value at $15 million. You've also said that you've got commitments of $300,000. Was that in revenue potentially? Well, hang on. If you just start again, because we've lost your voice.
Hi.
Yes, now we can hear
revenue.
you. Yes, right. Did you hear my question?
Yes, I did. So we have 300,000 committed in revenue.
And where is that from?
So that's from software companies, design companies, both in San Francisco and New York.
And it's a proprietary AI platform. What is the AI?
That comes through our assessment, which is basically a personality skill set assessment that focuses and hones in on the real ways that we can make sure that coaches are finding the right clients and executives are finding the right coaches.
Jenny, I'll bring you in. We know organisations, bigger organisations all over the world have a need for training and upskilling. What do you think of this as a potential platform to deliver it?
I mean, I think it's a really interesting idea. That is always the challenge that I think every company has, is ensuring that we're providing the right kind of, executive coaching and training to ensure that staff are able to move up. My question is, one is a little skepticism around the AI, so I'd like to understand that better. Does an employee fill out sort of a questionnaire that you then screen through and match to a coach? And then two, do companies pay, can somebody do a one-time coaching session because they have an issue that that they want to talk to somebody about, or are you committed to doing recurring coaching sessions? Who decides whether an employee gets a coach, and how does the model work that way?
Right. So starting with the first question. So our AI we have AI calendaring. So it's kind of like a calendaring assistant, note-taking, and so basically the AI is a virtual assistant built into our platform that we've created ourselves to ensure that the process is the most efficient. And it's all customized, guided towards the executive coaching industry. In terms of the assessment, it is a 20-minute assessment that we've teamed up with 2 Stanford neuroscientists to create a way for us to really get down to the 5 big factor personalities, so neuroticism and all of that, and then we combine all of that to find a compatible coach as opposed to someone that's similar to you. In terms of who brings us in, we are targeting L&D folks as well as CHROs, COOs, and CFOs. Basically, the decision makers in terms of the operational success of a company. And then it's a 12-month membership, so a yearly membership for one annual price, and then that can be paid out monthly as well.
Okay, and did you have Jenny, what did you think on top of that? Are you happy with the answers?
Well, I guess, so a membership for what? Is it by company? So any of my employees who want to use it once I've signed up, or is it a membership that's by employee, or how do you structure the membership fee?
It's per
executive that wants to use the coaching.
Yeah.
Okay.
Suni, is this a sort of idea that would interest you?
Yeah, I think depending on the company, obviously, but I think most companies do shorter stints than that. So you might want to think about more modular approach to that. We generally, in my experience, the different companies I've worked for would rarely sign up an executive for a full year. It would be needs-based, so there'd be a specific problem that they're targeting, presentation skills, for example, or how they deal with subordinates. And then they would want to start with maybe 3 sessions or 6 sessions, but I've rarely seen them sign up for a full year. So just a thought, you might want to modularize. I think that would expand your customer base.
Definitely, thank you.
And Chesa, what is the pricing model at the moment? Have you worked that out? Because obviously, what is the membership or the monthlies that you think you might charge?
So it is about 25,000 a year, and then monthly is roughly around the same with the 20.
For a business, covering how many employees do you think that would cover?
Per executive.
Per executive. Okay, so it's actually quite pricey as well. And what do the executives get paid? The individual coaches, because you're this marketplace really putting coaches with individual trainees.
Right, so that's scalable depending on the coach and their level of experience. So that varies.
All right, Jay, what do you think? What do you think about? Have you ever felt the need to get executive coaching?
I have seen it in some of the roles I've worked in before, but I guess my question is, are you going to take a cut on the coaches as well? Are you taking revenue from both sides?
Yeah, we're a dual marketplace, so we sell services to the coaches in terms of different services that we can provide to them to speedline their process and everything, and then we also get paid by the companies.
But the commission, from the coaches, so if the coach is, I don't know, $500 an hour, are you taking 30% of it? Are you
We're taking about 10.
10.
Okay. And
so you good value on that
yeah,
side.
well, that's okay. You're doing all right. And where do you create the coaches?
So we have a recruitment assessment that is built into our platform in terms of how coaches get selected, approved, declined. And we've been bringing on new coaches, about 2 or 3 every day.
How many coaches have you got in total?
We have about 20 at the moment.
Okay. Margot, what do you think?
We use coaching all the time. So to Jenny and Suni's point, it's something that, companies like to provide this kind of service for employees. I think maybe one way to think about this is you're creating a marketplace, and it's a disparate market, right? So sometimes it's hard to find the right coach and match them with the right person. So I like the idea that you're using some kind of algorithm to bring the parties together. I think there's something in here, though, where if employees had access to this service and you priced it in a way that employees could actually choose to have a coach for some interim period of time versus, I think you could have companies that are your counterparts, but if employees had access to this kind of service, it's basically like a Match.com for getting a coach. And a lot of times employees don't want to go through their company to get the coach. So if you created a way for employees to actually have access to this and figured out the price point for it, it might be something really interesting I think that's the kind of marketplace people would really try to access.
Good to know. Thank you.
Yeah, what do you think, Chaser, about that? Like, do you have a sense that you go beyond enterprise?
We definitely want to start with enterprise. Coming from the recruitment background, we have a very strong network of businesses that we have worked with for the last. Company's been around for 20 years. We do see value in the B2C space, but at the moment we are going to focus on B2B.
All right, Chesa, we wish you all the best. Thanks so much indeed for joining us on the Crowd Live today. We'll track your progress with interest. Chesa Yee, CEO and founder of Leader EQ. So we've heard a number of pitches so far, five of them. Who stood out for you so far?
Oh, I think I like the plastic bottles and the recycling into activewear, but I think it's got a lot more potential than just being in the US. I think it's got global potential if they can get the equipment and the technology right.
Okay, Jenny, what have you been excited by?
So I liked the urine analysis, but I have to agree with Prue because it's been my own personal passion around. You hear all these things about plastics, and so I literally have said, I got to find things that use this recyclable plastics. And so actually, I hope they are successful, and I hope there's a lot more of them because I think it's going to be very important for us as a society to be able to find a solution for that.
And Margot, you said at the beginning you wanted something that was unique and had a unique place in a marketplace. Have you heard something that fits that?
Yeah, I love the recycling idea, and one thing that I would encourage the founder there is to look at impact funds. There are a lot of investors that are coming together that want to invest in ideas like this that impact the environment. So I think that's a really good source of capital for that idea. I also like the urinalysis. I think that can reach a lot of different markets, and it creates a way to solve medical issues sort of as they're happening. And I think that has a lot of application.
And Suna, you were looking for passion as well as one of your key criteria. We've had quite a bit of that. Who's been the most passionate, do you think?
Oh man, to be honest with you, I think Ross, the odd one, right? I think Voyant Diagnostics. I think Claire was very passionate about her urinalysis, but hard to imagine that kind of passion. But it really, she's all over it, and I love the idea that the viewer put in there, right? The police stations. You just think about how much work goes into moving these tests from place to place to place before it gets done. I think it's a phenomenal idea.
Okay, well, look, that's a good... So we've still got 2 great pitches to come. Now, our next entrepreneur is using her expertise in technology and her own experience with chronic disease to create an innovative healthcare solution.
Remote patient management and monitoring is a $90 billion market, and it's growing.
I'm Star Cunningham, founder and CEO of 4D Healthware. What do we do? Artificially intelligent chronic disease management and remote patient monitoring.
Their blood pressure's checked, their glucose is checked, they're weighed daily. So if there's any problems or issues, I'm notified immediately. And whether the patient is rural or urban area, my patients will be monitored and watched closely to help reduce readmission rates.
I've been featured in Inc. and Vanity Fair, where 26 Black women founders were highlighted. Being me is the key differentiating factor between myself and the competition. My experience as a consumer of healthcare, managing my life with Crohn's disease and chronic pain, along with my extensive global background at IBM in artificial intelligence and machine learning, culminates into me, a passionate founder with personal experience. I have developed a solution that works, that is generating revenue, and that is more complete than any other solution in the market today.
And joining us now is Star Cunningham from 4D Healthware. Star, thanks so much for joining us. Really inspiring story. You're looking for $1.5 million for less than 10% of the business. You've already raised $2.8 million. Clearly the business is up and running. Just tell us a little bit, though, about your own story, because you've approached this as both a consumer of healthcare and trying to address the gaps in the market. What's inspired you to where you are today? What's driven you?
Absolutely. It's that experience and my background as an individual who manages Crohn's disease, which is a digestive disorder. Also, someone who manages chronic pain. So I have to take medication that doesn't always work. And I've had the best health care that money could buy as an executive at IBM, but I still was a victim of those gaps in care that you mentioned. And who better to fix it than somebody with the experience from the consumer side, but I also understand how to fix it using smart solutions.
And what are the gaps that you've experienced in healthcare that you're now trying to plug?
Absolutely. So I've been to the doctor and I've had a test taken that came back that I needed more iron. 48 hours later, I'm in front of my gastro, doubled over in pain because it's too much iron for my system to process. Well, why didn't I know that? Why didn't Walgreens know that when I went to the corner of Happy and Healthy to pick up the prescription? Why didn't my primary care doctor know that even though that was my lab result, it wasn't the right lab result for me, that it was okay for me to have that low iron level? And all of those gaps that I just described can be addressed with technology and education.
And that's what you do with your company. Prue, it's quite an inspiring story. What do you want to know?
It's amazing. I guess trying to understand the revenue model and the traction you've got so far with people like, insurers. I mean, are you using it for monitoring the elderly at home? Is it monitored over Wi-Fi? I mean, how does it work from a practical perspective?
All right, let me break those questions down. So question number one about our revenue model, we actually are reimbursed by insurance companies. So this is something that is paid for by the insurance company. It's a very complex process. Healthcare is a very regulated market. We've gone through the process of being approved with over 20 insurers, household names like Aetna, Humana, Cigna, Blue Cross, Blue Shield, all of them, CMS, Medicare, paying for our services. So that's question number one. Question number two, you asked about how patients are monitored. They utilize Bluetooth-enabled devices in the home. So if a patient has high blood pressure, it's a blood pressure cuff, diabetes, a glucometer. It depends, right? But we have over 400 devices connected to our platform, and we monitor patients remotely.
So that means and as we get to the Internet of Things, presumably this becomes a service that become even more encompassing. You're tapping into sort of where the future is going in terms of technology.
Absolutely. That's why our tagline is moving the minds of medicine. Just yesterday, I did an example with my internship team talking to the Google Home and having a video display on the Chromecast that was health related. So it came up on the TV in the home. But absolutely, all of the pieces and parts are here. I'm an expert at putting pieces and parts together in a smart way and delivering an end product to consumers.
Suni, got to bring you in here. What would you like to ask?
I'm just wondering, there's been a growing industry around telemedicine, right? Folks not having to actually go in to see their GP, but they can do Skyping or they can do video chat with their doctors to be diagnosed. Have you thought about tagging your product with that whole industry as it grows?
So that's a good thought. The industry that we're in is a $90 billion market called value-based care and reimbursements. So we are telemedicine. Telemedicine companies are competitors to us, but that entire space of delivering care through video monitoring, text messaging, email is part of what we do. And you're right, it is an extremely large market and growing.
And we've got a question here, Star, from John from the crowd, who wants to know, what's your competition? Who is your competition?
Yes, and that's a great question. We have quite a bit of competition, but we're the only company that has put the pieces together in the way that we have. So you may hear of companies like Enli, who primarily use phone calls to individuals who manage multiple chronic conditions, and they use spreadsheets and they follow up with phone calls every month. Well, as you know, a consumer is going to get exhausted and not want to talk on the phone every month. They already don't feel well. There are companies who already do revenue cycle management for healthcare. We've built that into our product, so that would be a competitor. And then there are companies who are focused on delivering remote care. You've heard of them. A lot of them are household names, but they tend to focus on consumers who can pay out of pocket. I have gone the difficult route of getting insurance companies to pay for my product.
Yeah, and you've got over 20 of them. Margot, Star's based in Chicago there with you, so it's good to see another Chicago entrepreneur. What do you want to ask?
Congratulations I mean, it's such a complex system. The medical system is so hard to navigate. So I just think it's amazing that you're trying to put all these pieces together. Maybe make it really simple for me and tell me, how do I actually access this? Like, so I'm an individual consumer. How am I accessing your service?
Today, as an individual consumer, you would have to walk into your physician's office and they would have to be our partner. By being a patient of that practice, you would be introduced to our product and service. At some point in the future, as we move data away from just the physician's office or the hospital or health systems, and consumers are more in charge of their data and information, you will find 1-800-4D-HEALTHWARE, where we can go direct to consumer and you can utilize our product or service. But today you have to be a patient of a health system that we're partnered with to deliver the service to you.
And Star, we've got another question from the crowd, from Dee. Says, healthcare is very capital intensive. So how have you been able to build this platform to date with under $3 million?
Well, that's a great question, and it's definitely not by choice. If you know the statistics, Black women raise about $36,000 to our Caucasian peers. So I would have had about $88 million if I were going to build this company. So I have had to be extremely scrappy. I've had to build a lot of relationships and partnerships. I've had to work very closely with electronic medical records vendors who are willing to work with me to integrate the product. So it's a matter of, I have watched every single dime and penny invested $250,000 of my own money. So it's been very difficult, but we are here with the product in the market, serving patients in this space of healthcare.
Well, look, that's fantastic. You are the definition of a bootstrap entrepreneur, and we appreciate you spending some time with us on the Crowd Live. Star Cunningham, CEO and founder of 4D Healthcare. I'm sure you'll get a lot of support and attention. Thank you so much for joining us, Star. Now, a final entrepreneur, or entrepreneurs, I should say, came up with their big idea after failing to find a product that helped them with a problem that they had encountered. It's a bit of a kitty obsession. Take a look.
I'm Arielle Lanskowski, and this is my mother, Shelley Lanskowski, and this is Ollie, and we are the founders of Kitty Obsession.
Kitty Obsession was founded with the mission of producing high-quality, utilitarian, innovative cat products.
We first came up with the idea for our cat carrier when we got cats and we realized how difficult it was to transport them to places we wanted to go. For example, drop them off at the cat sitters, take them to the vet, or for me to go from Las Vegas to Los Angeles to visit my children.
The carrier is unique because it includes everything your cat needs on the go, and even at home. It comes with containers for food and water, a scooper, and trash bags. Most importantly, the carrier includes a portable litter box closed off in its own compartment for use when you arrive to your destination. We are selling the bag at $139.99 retail price. It costs $60 per bag for manufacturing and shipping, which gives us a profit of $79.99 per bag.
We are currently at the launch growth stage. We have marketed on social media platforms such as Instagram and Facebook. Our cat carriers are sold out on Amazon, and we are currently in the process of replenishing the inventory. Walmart also contacted us through Instagram to add our product to their website. When we reach the 325 bags sold mark, all sales will be pure profit as our initial cost of manufacturing will have been recouped.
First and foremost, we're seeking exposure from the crowd. We're also seeking advice, mentorship, and possibly a partnership.
And Arielle and Shelley Lanskowski, the founders of Kitty Obsession, join us now. Thank you both very much indeed for joining us. You're not necessarily looking for investment, but you're looking maybe for marketing help. Now, one of these kitty bags, what retails at what, $130, just under $140 each. What's your profit on that?
Our profit is the bag costs per bag $60, which we added the shipping from China. So $60 cost, we sell for $139, so our profit currently is $80 per bag, which brings our gross profit margin to about 33%. And we've sold 85 bags so far, so we're at $12,000 in revenue.
And 325 bags basically covers the initial cost of production if you sell 325, is that right?
Absolutely, yep. That's our mark. Each 325.
All right, so you're tapping into a passionate cat market. Jenny, I don't know whether you like cats or not, but do you like the idea?
So I do have a couple of cats. First question is, can this go on an airplane? So does it qualify? Is it small enough that you could put it, carry it on a plane and go under the seat? And second question is, does the cat litter spill very easily? It wasn't clear to me how that would sit in that tray, or are you adding that later? Because you seem to put it in with it on.
Very good questions, because as a matter of fact, we get those frequently on social media. Is it airline approved? And that was not the original intention of this bag. This bag was for short trips, cat sitters, or to a friend's house. That's what it was designed for. So the bag cannot fit under a seat or even in the overhead compartment. It's mainly designed for car trips. For example, when I go to Los Angeles to see my children from Las Vegas, it's 4.5 hours. And I pack the cats up, and I stop in Barstow, unload the litter box, put it on the floor, go into Starbucks, and the cats get out, use the litter box. I come back, clean it up, and put it back into the litter tray compartment. So that's what
Sorry, to add on to that, no, the litter does not spill over easily, and it is in its own separate compartment, completely closed off from the cat. We had misconceptions with that. People thought that the cat goes to the bathroom in the bag. No, that's not true. The litter box slides out underneath and is to be used upon arrival to your destination.
And just to elaborate a little further, as far as the spilling, the bag is made of durable, washable material. So anytime you want to clean that litter tray compartment, it's very easy to clean.
Mark?
And
Yeah, go ahead, Jenny.
I was just going to ask, and have you taken, done any surveys or, as far as the market that would be willing to buy the bag that is only used for transport? I would think if you were buying a bag, you would want the flexibility to be able to go on an airplane.
Absolutely. And we didn't do any research. It was based upon our own needs and what we knew we would use, which I've used it a ton, and so has Ariel, because the other design, part of one of the trial and errors we went through with designing the bag was we wanted it to be a cat house. I didn't want it to collapse when I unzipped it. I want, when I drop it off at a cat sitter's or I go visit somebody, I want the cat to be able to feel like he could sleep in the bag comfortably, and they do. Often our cats are found in our cat houses sleeping. That's where they like to sleep. And
so it also serves as a cat condo. A lot of our customers have been saying that that's one of the biggest strengths of the bag as well, because it's cozy and cave-like. It's not a traditional cage-looking carrier. The cat can hang out and sleep in it. And a lot of our customers also have told us that it's perfect for evacuations, especially like in California with all of the fires. So it's also useful for that as well.
Margot, I need to bring you in. Are you a cat lover, Margot? Is this a product for you?
I have to be a cat lover. We have a cat that looks just like one of those cats that was in the video. So I think there's real practical application here, and there's a lot of times where we found like we needed something like that. I guess the question I've had is the price point. So do you feel like the price point, how have you thought about that? Because it seems a little bit high to me. And I think if you're trying to get it out sort of in mass use, that I think pretty carefully, you have a pretty good profit margin there. So I guess my question is, how did you come about the price?
And good question, Margot. We did do some research on. We researched Amazon and other cat carriers that were available, and the lower end priced cat bags would collapse when you unzip them. They weren't as durable. They didn't obviously have all the extras that we have, the litter box included, the scooper, the containers, etc. So we started looking at the higher end bags, which again did not include any of that, and were not like our cat bag, because by the way, there's not one cat bag that has a built-in litter box on the market today. And the exciting news is we just got our patent. After 2 years, we had a design patent. It was just issued, and it will be issued in April next month. So to answer your question, that remind me what the question was. Sorry.
It was bringing the price down, and we had a related question to that from the crowd as well, which was, can you reduce the cost of production, or will that happen if you get into mass market? You'll get some scale.
We have so many exciting points that I get thrown off, and I'm sorry. We absolutely could bring the price down and had listed the cat carrier for sale on holidays, etc.
We've been running specials on holidays. So
right, and we'll keep doing that, and we have considered that, especially with the millennials. They may have less money, and maybe some of them have asked Ariel, when will this go on sale? And so that is a consideration we may need to really consider seriously soon. But so far, the other markets, some of the women or seniors now, they say that they're seeking cats for companionship. They haven't really ever balked at the price, and nor have the people around us. We've sold a lot of bags just by talking to people. They see our bag, and then we sell one right there on the spot. We give them our card and tell them to go to our website. Okay. But yes, we would consider that.
Okay, Ariel, Shirley, so good to have you on. We wish you the best. Clearly you get on. I mean, it's not easy sometimes having a partnership between, the children and their parents, but it's clearly working for you. So we wish you the best. Thanks very much indeed for joining us. Ariel and Shirley Laskowski joining us from LA. And they're our last entrepreneurs of the show. But before we say goodbye, let's just get another sense of, particularly of those last two pitches from our experts as well. Prue, just starting with you, the last two pitches. Yes. Which one did you? I don't know whether you like cats or not. But
I'm not really a cat person, but in any event, I think Star is. You know, I think if people are looking for passion, I think that's a woman right there on a mission, and I think she will find a way to make that business work. So very impressed with her. Yeah, Margot. I mean, a Chicago entrepreneur there. You must have been. Were you quite inspired by what Star's doing?
Yeah, I mean, it's the medical system is so complicated, and she's trying to simplify sort of bringing all the pieces of it together. And I think, when we talk about identifying a problem, that is a huge problem. And I agree. I think her passion is very clear, and she'll figure out how to bring those components together. And as consumers of a healthcare system that's hard to navigate, I think it's a great idea that she's got.
Suni, what did you think of the last two pitches?
Well, I thought they were great, though. Confess, I'm a dog person myself, but Margot's right. And just to add to that, right, technology is making it easier, maybe, or more credible in terms of telemedicine. But the demographics of this country, we're going to need this more and more and more. What Star is talking about is the future of healthcare, and we need products like hers. So it definitely fills a growing need.
Jen, I'll leave the last word with you from our expert. Sum it up for us.
Yeah, well, I would just say that, so I'm on a board of a children's hospital. I have a son who's a type 1 diabetic. And, one of the big issues on any kind of entrepreneurial efforts with respect to medicine is getting insurance reimbursement. And it's a really hard thing to do. So the fact that she actually cracked that is amazing. And I agree with all the comments said before. There's a tremendous need there. It's complicated. There are a lot of factors, and I applaud her efforts and cheer for her.
Well, thank you so much. We'll cheer for you as well. Thank you very much indeed for joining us, Jenny, Margot, Suni, and Prue with me in the studio in London. Thank you to all for joining us on the Crowd Live. And don't forget, if you think you have a great business idea and you want to join the crowd and even get in here on the Crowd Live, you first have to sign up to the app. Here's a reminder of how you do just that. We source all of our guests exclusively from the pool of the most followed entrepreneurs on the Crowd app. It's completely free to upload your 60-second pitch video on our website, thecrowd.net. For those of you looking to invest in some of the ideas you've seen tonight, or maybe you'd like to see what else is on offer, you can download the app. There you can watch all the pitch videos and swipe right if you see something you like. Finally, if you don't want to miss out on the next live show, or you want to watch an episode that's already aired, all you have to do is go to the upper right-hand corner of the homepage and simply click on the Crowd TV icon. So that's it. No reason not to get involved. Remember, your next investment opportunity could simply be just one swipe away. Now, next week for the Crowd Live, we're going to be going to Margot's hometown. Yes, we're in Chicago. I can't wait. Don't miss it. We'll see you there. Until then, goodbye.